Is it possible to be pregnant and still see your period? I've seen several women talk about this, that they are pregnant and they are still seeing their period. Why is that? Now this is what I have to say about it. Keep watching. Hello guys, what's up and welcome back. This is Everything Health with Nurse Dera. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Dera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. Now, first of all, let's talk about menstruation. What is menstruation all about? In every woman's cycle, after ovulation occurs, after an egg has been released, that particular follicle where that egg was released from begins to release a hormone called progesterone. So this hormone progesterone causes the lining of the endometrium to thicken and prepare itself for implantation. That is, to thicken and prepare itself to become a bed that this fertilized egg will implant on and begin to develop into a baby. So what happens is, after ovulation, and this progesterone continues to make the lining of the uterus to thicken, and then fertilization does not occur. That is, after the egg has been released, there is no sperm available to fertilize that particular egg. What happens is that when the fertilization does not occur and the egg die off, the levels of this progesterone, which was high before, causing it to make the lining of the endometrium to thicken, begins to decrease. And when that happens, that thick lining of the uterus starts to shed, and this is menstruation. So what I'm trying to say is that it is not normal to bleed when you're pregnant. There are different types of bleeding some women confuse with menstrual flow. One of them is implantation bleeding. Implantation bleeding usually occurs 2 weeks after ovulation. That is when the egg has been fertilized, and that fertilized egg is trying to implant itself into the endometrial wall, where it is going to grow for the next 9 months. So when the implantation occurs, some blood vessels may be tampered with, and this can cause bleeding, but that bleeding is usually light bleeding, and it usually doesn't last for more than 24 hours. So 2 weeks after menstruation, and some women see blood, and this usually occurs at the same time the woman is supposed to see her next period. So usually they confuse that implantation bleeding for menstrual flow. So another reason why you're seeing blood when you're pregnant is when the placenta is developing and growing. So when the placenta is growing and is developing, there are possibilities that the blood vessels around them can be ruptured, and this can lead to light bleeding as well, but not heavy bleeding like menstrual flow. Now let's talk about causes of bleeding during your first trimester. One of them is miscarriage. Miscarriage usually occurs during the first trimester. That is the first 1 to 3 months of your pregnancy. We have different types of miscarriage. We have the complete miscarriage, we have the incomplete miscarriage, we have the threatened miscarriage. So when any type of miscarriage occurs, the woman notices bleeding. Another reason why bleeding might occur during your first trimester is when you have what we call placenta previa and placenta abruptio. Now let me explain what this means. Placenta previa means when the placenta implants at the lower uterine wall, sometimes partly over the cervix or completely over the cervix. This can rupture the blood vessels around there, and bleeding will occur. Then placenta abruptio is when the placenta detaches itself completely from the uterine wall when the woman is still pregnant. Then this can lead to bleeding. This can happen when there is a case of violence, maybe a hard blow to the woman's abdomen. The placenta can be forcefully detached from the uterine wall, and bleeding will occur. Now I'm going to leave you all with this. When you confirm that you are pregnant, you've done your blood test, your home test, and all of that, and you confirm that you're pregnant, you are not supposed to see blood at any point in time during that pregnancy. So whenever you notice bleeding of any type when you're pregnant, apart from the implantation bleeding I talked about, whenever you notice bleeding of any type when you're pregnant, please leave whatever you're doing and rush to the hospital, because this can be a matter of emergency. For your own sake and your baby's sake, leave whatever you're doing and rush to the hospital whenever you see blood at any point in time throughout your pregnancy. No matter where you are, whether you're in the market, you're in the church, you're in school, you're anywhere, once you notice blood coming out from you while you're pregnant, move from there straight to the hospital. Don't even get home first, just move straight to the hospital. Head to the hospital and get yourself checked out. This is it for now. Please do well to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section if you have any question, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. See you in my next one. Bye.